Hello friends, let us now learn some important points about the air gap techniques. So in the air gap techniques, the X-ray grid is very important to reduce the scatter radiation with a larger radiographic fields. But there is one more alternate method for reducing the scatter radiation is air gap techniques. So air gap technique is an alternate method for scatter radiation reduction and it causes less patient exposure. The basic principle of this air gap techniques is simple. So a scattered radiation which is arising from the patient, so this is the X-ray tube and primary radiation. The scattered radiation which is arising from the patient falls onto the film, and this scattered radiation disperses in all directions so that patient will act like a light bulb. So the scattered radiation is shown to be radiating out from a point source, but the point is actually represents a tiny block of tissue. So it looks as if it is a light bulb. So each ray will represent the scattering within a small block produced the array as shown. So each ray is a separate scattering event here. So let us see how we can describe this. So this is the X-ray tube, this is the patient. So this is again the X-ray tube, this is the patient. Now the film is placed closer to the patient. Here the film is placed farther away from the patient. So the closer the patient is to the film, so the scattered radiation which is present from the patient is reaching the film is greater. So closer the patient is to the film, greater is the concentration of scatter per unit area. Then with a larger air gap as shown here, the concentration of the scatter reaching the film will decrease because more scatter photons will miss the film. So this is called as air filtration. So closer the patient is to the film, the concentration of the scatter per unit area is more. So if air gap is present, with air gap the concentration of scatter radiation decreases because more more photons will miss the X-ray film. So for these air gap techniques, there is one more reason, name that is air filtration. Here you can see a film. If the film is close enough, all these scattered photons will affect the film. Whereas if the film is farther away from the patient, then these scattered photons, scattered radiation misses the film. So this is important. So here for the air gap techniques, so the scattered radiation decreases not from filtration but because the scattered radiation will miss the film. So scattered radiation are not absorbed by the air, they are just missing the film. So the name air filtration has been applied to this air gap techniques. But there is no filtration or there is no decrease in scattered radiation from filtration. So negligible quantities of scatter radiation is absorbed by the air gap. So the beam is not hardened. So as a result, air filtration term should be discarded now. There is also a strong bias for forward scattering in diagnostic radiology. The Campton scattering or the distribution of Campton scattering is nearly random in distribution. That is, it can occur in all angles. A photon is almost as likely to scatter at 90 degrees or 45 degrees or 180 degrees. That is, the scattering of this Campton scattering is random. But with increasing energy, more photons will scatter in forward direction. But the increase is negligible in the diagnostic range. But this increase in photon scattering is negligible in the diagnostic range. So when an incident photon increases, when the energy of an incident photon increases from 10 kilo electron volt to 140 kilo electron volt, there is a much greater change is likely in radiology. The most common angle of scatter only changes from 53 degrees to 45 degrees. So as a result, strong forward bias, as in mega voltage therapy, air gaps is ineffective as a means of controlling scatter radiation. So at higher kilovoltage, the air gaps are ineffective. But in diagnostic radiology, because lower kilovoltage techniques are most commonly used, so as a result, air gaps can be used. Next. Next, if you have to compare the scatter radiation arising from the superficial and deep tissues. So this is the patient, this is the air gap, and this is the film. So here, this is from the center of the patient. The scatter radiation when it arises from the central part. Now, if the scatter radiation arises from the deeper tissues, okay. So here in these two images will compare the distribution of scatter radiation from a deeper tissue. Here the scatter radiation is arising from the deeper tissue, whereas the scatter radiation arising from the superficial tissue. So you can see more radiation reaches the film. So here we can see that the more radiation is reaching the film when the scatter radiation is near the deeper surface tissue blocks or near the exit surface. When more radiation reaches the film, when scattering occurs near the exit surface, because film intercepts a larger angle of scattered beam. So the angle of interception is larger for this for this deeper structures or for the exit end. Whereas if the scatter radiation from the entry end or so in the superficial structures, here the angle of interception is smaller for scattering occurring on this input side. So this will appear as a natural gap. So it occurs as if there is a natural gap between the film and the scattering side. So this extra gap is also present. So as a result, so this difference in the in contribution from two sides is greater than this illustration implies. So if you see here, more scattered photons from the input surface are absorbed. So if scattering starts from input surface or superficial surface, the scattered photons are absorbed during their journey through the patient itself. Whereas those exiting from the exit surface have shorter escape distance. So here there is more escape distance, there is less scattered. So some of the radiation is because it is absorbed by the deeper tissues. Here the radiation is not absorbed by the deeper tissues. So hazard is one more important thing is there are two factors uh, which can be seen here. In the exit surface, there are mainly two factors. One, angle of capture. Second, less tissue attenuation. So there are two factors which affect this scattering, which are angle of scatter and the less tissue attenuation. So for deeper structures, they have larger angle of scatter beam, whereas for nearer structures, that is for entry site or for superficial structures, there is a smaller angle of interception. So most of the scattered photons reaching the film arise immediately from the superficial tissues, can be decreased by air gap technique. So if you see here, the number of photons which are reaching the number of scattered radiation reaching the film is more for deeper for the photons which are generated from deeper structures than from the superficial structures. The next important thing is optimum gap width, which we will see in the next class. Thank you.